We've had some experience with a bacterial infection that is almost always acquired when you're in the hospital, usually when you're in the hospital for a surgery, so you're in the hospital for several days or longer. And C. diff is a bacteria that is present all over hospitals. It's present on tables, it's present on counters, it's present on instruments. Studies have been done to show that C. diff the bacteria is found everywhere in hospitals. And what we often see is that people that are healthy will not, when they're in a hospital, they will not acquire the C. diff bacteria. However, if you're in a hospital and maybe you're not in the best of health or you're there for an extended period of time for a surgery, you can get C. diff. And typically what happens is that C. diff can be present in your body and yet you will not actually get sick from the C. diff. What often happens is that a person who's in the hospital for a surgery will receive some sort of antibiotic just as a precaution from the doctor to prevent a person from getting a bacterial infection from the surgery. But what happens is that after taking an antibiotic for several days, that kills the good bacteria in the intestine, and C. diff then flourishes and it will start attacking the tissues of your intestine, will actually cause the death of your intestine. And if it's not properly diagnosed and treated, it will actually kill you. So we've had some experience seeing C. diff not being diagnosed, which is very easy to be diagnosed. Samples are taken from the body, looked at under a microscope in the hospital, and C. diff can then be diagnosed, and the treatment is very simple. Medication will eradicate C. diff and you will be completely cured and healthy. And what we've seen is sometimes a person will show the symptoms of C. diff, but it's not picked up by the doctors and nurses, and then the C. diff is left to grow like crazy. It will kill your intestine and then it will kill you if it's not treated. We've also seen some situations where it is diagnosed and treated, but the treatment is not lengthy or significant enough to kill off the C. diff 100%. And if you stop the treatment very quickly, let's say after just a couple of days, it will grow back and of course kill your intestine and then kill you. So if you believe that you or a member of your family or a friend got C. diff and it caused a significant injury to you, then you should give us a call and we can review the medical records and determine whether there was a failure to diagnose and treat the C. diff.